Hello, I'm Dr. Christopher Fry of Circle Chiropractic Center. I would like to share with you today an example of three of our patients who many people have amazing experiences with chiropractic. This is just three that I chose to share with you. The first one is we will call the young Sniffler. This is a mom who brought her 4-year-old in for care for terrible sinusitis, ear infections since birth. He had been on several antibiotics that provided minimal or temporary relief and was about to undergo tympanostomy, ear tubes. He was too squirmy for x-rays when they came in, but his EMG was all red and blue instead of white and green the way it should be. This indicates nerve interference, and especially was evident in the upper respiratory, ear, and immune parts of the nervous system. Palpation revealed various subluxations, meaning that I could feel the misalignments, probably from birth trauma, with my hands, especially at C1, C5, and T3. His voice was totally nasal, and he was sick and slack-jawed because he couldn't breathe through his nose. We began adjusting very gently, which made him giggle, and he said he could breathe better after each one. After several weeks, his breathing had improved tremendously. He could breathe through his nose, and he said he could hear better. He was able to forego the ear tubes and has never required antibiotics since then. Consider for a moment the less obvious improvement in this child's quality of life. Improved hearing and breathing has enabled him to be more attentive in preschool and better able to engage socially with his classmates. His mom reports these changes, and also that his activity level and his skills in athletics have improved markedly. Wow. We treat the whole family now, and I'll never forget when they were little and all this came about. So patient number 2, let's call him the old golfer. Gentleman, real friendly guy, talkative, 65-year-old. He loves to golf, but he couldn't now due to low back pain. He came in for care. His swing, he told me, was painful, and he couldn't walk far enough even while using a golf cart. We identified nerve interference in his lower back and his neck, and we began adjustments. He responded well. He's walking well enough to forego the cart, and his improved swing has lengthened his drive by 10 yards, and he's pain-free. Next time he comes in, he says, "Dr. Fry, does chiropractic cure Alzheimer's?" I was startled, and I said, "No, but why do you ask?" He said he had been forgetting things, was unable to recall names frequently, and felt fuzzy-headed much of the time, unclear in his thinking. He said that this had cleared up around the 3rd week of care. He was relieved and thankful, but hadn't thought much about it until he became forgetful again after bumping his head on the car door frame. This immediately cleared up again after his next adjustment. I explained that there are many types of dementia, but they are all associated with cervicocranial subluxation. The bones of the head and the neck, when misaligned, can diminish cognitive abilities. And I was thrilled to see him respond in the way that he had. We then carefully reviewed his procedure for entering and exiting the car. Can you imagine the fear and anxiety that this gentleman must have experienced, thinking that he was doomed to a progressive state of worsening memory? He recounted to me how much more satisfying his social interactions were on the golf course since his care and with his family. He said, "I've knocked 3 points off my handicap, And they even laugh at my jokes more. Case number 3, the aspiring mom. 38-year-old lady came in for help conceiving a child. She had had low back pain for years, but her chief concern was inability to get pregnant. Even after several efforts at different kinds of in vivo fertilization, including her husband being examined, she remained barren. We found subluxation in her lower spine, her mid-back, and her upper back on EMG, X-ray, and palpation. I explained that I couldn't promise anything, but that misalignment and nerve interference were definitely keeping her from functioning at her best. In fact, when we traced her level of subluxation, followed the nerves from it to the organs, it turned out they went directly to the uterus and ovaries, among other places. We began care. After 2 weeks, she said she's feeling better and moving better. 2 weeks later, she says she has more energy. After 4 weeks further, she comes in ecstatic, saying she's afraid to believe it, but she's 6 weeks pregnant. Flash forward, she had a normal gestation to full term and delivered a healthy baby boy. By the way, her OB told her that for a pregnancy so late in life, she had a much smoother delivery than average, with far less than the usual amount of intervention. 2 years later, she had a baby girl, and both of her kids came in for checkups on their spine and nerves over, say, once a month, episodically. Once a month for checkup, but if they had an episode, bumps, falls, colds, or flu, they came in and got checked. The mom calls them her miracle babies. They moved out of state, but she assured me that they continue with their chiropractic checkups. How can we measure the lifelong impact of changes like these? I encourage you to imagine the blossoming that happens within one's life, anyone's life, when the nervous system is allowed to express health and healing fully. As our toxicology professor used to say, if all you did was to get your patients off of medications, you would be adding life to their years and years to their lives. Thank you for listening. If you've been inspired, please share this video with your friends. And if you have personal questions that you'd like to talk with me about, I'm available at Circle Chiropractic Center. The telephone is 703-385-2990. And be happy and healthy.